Assalamualaikum everyone, welcome to my channel Medical Lectures and Mnemonics. Today I'm going to talk about a very important topic which is the endometriosis. So in the previous two videos I have already talked about the anatomy of the uterus and the anatomy of the fallopian tube, and I have talked about an inflammatory condition of the endometrium which was the endometritis. So in this video I'm going to talk about the endometriosis, but here I'm going to discuss simple anatomy of the uterus. We have three layers. What is the endometrium? Here you can see this black layer of the uterus is called endometrium, and this green layer is called a myometrium, and a layer which is present just on the uterus, which is the perimetrium. So the endometriosis is the presence of the endometrial tissue just outside the uterus. This condition is called endometriosis, and there is another condition which is called adenomyosis, and it is the presence of endometrial tissue in the myometrium of the uterus. So the endometriosis tissues are present just outside the uterus. So common site for the endometriosis are the ovaries, the pouch of Douglas, which is the space between the rectum and the uterus, and the uterine ligaments like the broad ligaments, and the uterine tubes, and rectovaginal septum, which is a fascia that separate the vagina from the rectum. These are the common site for the endometriosis. So peritoneal cavity and paraumbilical tissue main walls, and rarely, very rarely, the heart, lungs, skeletal muscle, and bone may be involved. So, how the endometriosis develop? There are four theory. One is the regurgitation theory, the benign metastatic theory, metaplastic theory, and extrauterine stem or progenital cell theory. These actually discuss that how the endometriosis develop. So the regurgitation theory is the most common and the most acceptable theory, and this theory states that the backflow menstruation can cause the endometriosis. Endometriosis. The other is benign metastatic theory. In benign metastatic theory, the endometrial tissue are spread into other area than the uterus through the blood vessel and the lymph vessel. The third theory is the metaplastic theory, in which the normal mesothelium of the pelvis and abdomen converted into the endometrial tissue. The other is extrauterine stem or progenitor cell theory. It states that the stem or progenitor cell which produced in the bone marrow may convert into the endometrium. So the most common theory in this four is the regurgitation theory, which is the most common acceptable theory. And there are two main symptoms by the endometriosis. One is the pelvic pain, the other is infertility. These are the two most common symptoms. So the pelvic pain, the endometriotic tissues are responsive to hormone, and when they deprive from the hormone like estrogen, it will cause the bleeding. So when this bleeding is not drained by the blood vessel, the lymphatics or the immune system, it will cause the swelling of the area in which the endometrial tissue present. So the swelling will trigger inflammation, and it will cause the pelvic pain. The other is infertility. The infertility occurs as a result of inflammatory condition, and the inflammatory processes actually disturb the various processes of conception, and the infertility may be due to the anatomical distortion due to endometriosis. The other is dysmenorrhea, which is the painful menstruation, and the other symptom is dyspareunia, which is the painful sexual intercourse, and the other symptom is metal skimmers, which is the which is the pain associated with ovulation. So the pelvic pain and infertility are the more common symptoms, while the rest are the less common. So the endometriotic tissue are responsive to estrogen and progesterone. So the endometriotic tissue also produces the prostaglandin 2 in aromatase. Aromatase will convert androgen into estrogen. So The prostaglandin inhibitor and the aromatase inhibitor are used as a treatment option for the endometriosis. So this was all about the endometriosis. For more videos, subscribe, like, and share.